For this virtual learning environment, we are going to be looking at nursing students and move away from the traditional computer screen interface by placing the focus of learning solely on the interactions with the patient and the body. Often VLEs act as an interface between the student and the institution, where communication and collaboration are forced through the prism of academia and things that academia has typically declared as important. Instead, we believe that relationships between tutor and students, students and students, and students and patient are key. There is a significant disconnect between the different mediums used in the administration and environments that we teach. We might learn technique, theory and application using one medium, communicated and administrated with another, and be assessed and receive feedback in yet another. We sought to create a VLE that was particular to the personal experiences of that student, that overcame technical and cultural barriers to engage students of all types. Our proposal is that all activities take place in the physical form of a patient. This is not an addition to the reassuring monolith of web-based VLE. This completely replaces it. The entire module run, its administration, the setting of assignments, assessment and feedback all use a mannequin to interface. While simulation dummies are now common in many learning environments, they are currently designed as physical units for students to perform single routines or tasks on. They are bodies devoid of lives lived and experienced. This approach treats the VLE as a patient, and we suggest that all previously digital learning and course administration happens through the physical metaphor of the body. Over time, weeks, months and years, a relationship develops. The VLE as a patient/body learns and changes as the student learns and changes. So how does it work? Well, using sensors and wireless networks, they enable the triggering of events such as physical changes, limbs, temperature, position, and media, voice, sound and augmented video. Students experience an augmented overlay, for example, a wide range of lifelike patient faces, skin tone, age-related skin elasticity, visible wounds, through lightweight AR glasses. They interact with the mannequin through a variety of sensoring technology, including active and passive RFID, Bluetooth, facial recognition, voice recognition, and microphone and video camera. Using these techniques, the mannequin is able to sense what time it is, where the student is, what they are near to, what the student has already done, who they are with, and any sound in the room. In time, natural language, voice-operated delivering chatbot technology would interact with the student. These guided conversations will develop to more organic interactions. Triggered events also respond to rules and prompts dictated by the back end of the VLE. Example, assessment points throughout the year, ward opening hours, etc., as well as more lived interactions with the student. This interface challenges some of our assumptions and requirements about a modern VLE. Students need to be with the patient to interact with the course of study. They need to be present, talking, checking and testing. They will research away from the patient, talk to colleagues and debate outcomes. But it is their relationship with the body that matters. Their physical interactions with a virtual identity are the drive of their learning and development of practice.